Hey, what's up, everybody? This is Kayla. And as you can see, this episode of Smoke Break looks, feels, and sounds a little bit different than usual. Due to the soaring cases of COVID, we did a remote interview to keep and make sure that everyone was safe. My name is Denisha Porter, and I am the executive director of All in Cincinnati, and I lead a racial equity coalition working to dismantle racial inequities in our 5 priority areas of health, housing, education, economic mobility, and justice, with the goal to uplift and elevate Black women in Hamilton County. I was pre-med at Miami University. I ended up getting my degree in microbiology, but I decided that I did not want to be a doctor. And all of my friends and family just encouraged me to work at a hospital and from there figure out a different career path. And while I was there, I ended up working on a cancer floor. And then I found out that I had cancer at the same time. So after going through that experience, and I had really great health outcomes, but I was able to work on that cancer floor, and I really saw different experiences that people had with cancer, and it really ignited a passion in me to go back to school and get my master's in public health. Health equity is really about meeting people where they are, giving people what they need. And it's also really about having no outcome based on race. And so currently, there's a lot of different health disparities in the Black community, especially around chronic disease, heart disease, stroke, cancer, infant mortality, asthma. And so I think a lot of that is not having targeted approaches to access to care, not really having culturally competent ways that are implemented in healthcare systems, and not having like a diverse workforce. So I think addressing some of those issues will help with some of the health inequities and health disparities that we are seeing in Hamilton County. I think one of the biggest things that still needs to be addressed in the Black community with the healthcare industry is that trust. And so there has been a lot of situations where there were unethical procedures and treatments and practices that happened to Black people. And so that caused the rift in the community to really trust and go to the medical community for treatment and to feel safe to do so. I even know, like, my personal experience when I was born, there was an issue with my feet, and so the medical doctors talked to my family, and they really wanted to like reset my feet, break my feet and reset them because they thought I was going to have an issue with walking. And there was a lot of hesitancy in my family to have that procedure done. And so what my grandmother did actually was she really did not want my mom to do the procedure, and she just she said she will walk and it won't be an issue. And so what she did was every night she would basically bathe my feet, pray over my feet, and she would put my shoes on the opposite foot, and I would sleep with my shoes on the opposite foot. And it actually worked, and it straightened out my feet, and I was able to walk. And so that's something that actually worked out for me. But the real issue is that sometimes that doesn't work, and that people do need to seek medical care and medical professionals earlier so that they won't have worse outcomes. And so I think that as we continue on our journey as it relates to health equity and working with medical professionals and doctors, that we do really build a stronger rapport with patients. And I think that really starts with being honest about where we started with that journey, and then building on that and moving forward. Mindfulness and yoga and things of that nature are so important, and it can actually help with anxiety and depression. And I think sometimes when we're anxious and we're depressed or just feeling overwhelmed, we start coping with unhealthy things such as smoking. And so being able to kind of change your environment, change the way you think, slow down, take deep breaths, do yoga, exercise can be a really healthy way to combat stress. If someone is thinking about quitting smoking, I would say do it. I think it is the number one way for you to prevent diseases such as cancer, heart disease, heart attacks, and stroke. I think also I would tell them to make sure you get a good support system to help you along your journey. And I will also tell a person, if you try to quit and you for some reason something happens and you smoke again, that's not the end of the world, that you can always start over. There's, like I said, every day is a new day. So anything that you're having trouble with and you feel like you kind of fell off the bandwagon, the next day just jump right back on and just continue your journey until you meet your goal of quitting.